Welcome to The Next Word. I'm your host, Chris Warnke, and we are doing these shows virtually throughout the next couple of weeks. But I wanted to say that we're glad to be back, and I think you'll enjoy our show tonight because we're featuring Ms. Donna Mazyck, who is the Executive Director of the National Association of School Nurses, as well as the President of the National Association of School Nurses, Laurie, Combe. Today, we have a problem in this country because we're going to be seeing a shortage of school nurses due to COVID-19. And our guests tonight are going to talk a little bit about what we can look forward to in terms of the upcoming school year in the fall and the kind of guidelines we're going to have to follow, but also what we can do as a country to make sure that our children are safe. So with that, I'm going to turn to Laurie Combe, who is the president of the National School Nurses Association. And today, May 6th, is School Nurse Day. Laurie, wonderful to have you. And please tell us about the association and what you all are doing and the guidelines and some of your concerns as we move forward in these summer months.
Christine, thanks for having me today. The National Association of School Nurses is a member organization of school nurses working across the nation and some overseas in Department of Defense schools. And our members support student health and learning on their campuses. They are essential members of the school team and can bridge health and education so we can coordinate that care for students, translating it from the healthcare realm into the educational setting. Some of the concerns that we have about school nurse staffing are related to the perception of the school nurse role, and others are related to funding. We know from the data that 25% of schools have no school nurse at all. And I've been reading in our member forum that states are projecting budget deficits because of this work shutdown, and that translates to decreased budgets for school systems. And unfortunately, when school systems are faced with that, they look to which positions they can cut, and often that's a school nurse. I want to say that would be ill-advised in this current situation because school nurses have been working all through this pandemic to provide school systems with facts, with evidence, working against the myths and the fears, right? So that schools can make the right decisions to keep students and families and the broader school community healthy.
Right.
When we reopen, we will be challenged to understand how to physically distance the school community in classrooms, when we gather for meals, when we need to have physical exercise that we know is essential to helping students translate their learning into cognitive action. So school nurses need to be at the table. How will schools manage suspected cases of COVID-19? The guidance says that we should isolate those students. And if schools don't anticipate that need in advance, they won't have prepared a space for that to happen.
Absolutely.
Right?
No, Laurie, there's many, many challenges. And you're right. You're absolutely right. The concern with the state budgets, unfortunately, shrinking as a result of COVID-19, it's going to hurt a lot of areas, but particularly with the school nurse population in terms of funding the school nurses. And we're going to have a serious issue. And I know parents are going to be concerned, school administrators, school public health officials, and it's going to be a big, it's a big issue coming in August and September as students hopefully are coming back, to the into the school classroom. So I know you all have. I mean, it's going to be a tremendous burden on the school nurse, because really the school nurse is the first line of defense in terms of a child that gets sick. And look, can we talk a little bit about just there are many issues that I think a school nurse is confronted with in terms of a child coming to the school nurse for help. One of them being mental health. There's been a lot of discussion around mental health. And even in the Washington Post today talked about just the anxieties that we're starting to see with children being, of course now being, school homed. But can we talk a little bit about that too? Because these are all these issues that I think new issues and issues that have been there, but I think they're coming to the forefront.
You're right, Christine. We anticipate an increase in mental health concerns. The fact is that even prior to this pandemic, school nurses were reporting already that there had been an increase in these concerns in the student population. But school nurses are sentinels, right? We are right there when children come to the clinic, and perhaps they don't have the language to express their emotions, their anxieties, their fears, or they're afraid of stigma if they talk about mental health concerns. And so that often presents as physical complaint. And school nurses are skilled in identifying those complaints early and making appropriate referral for students to get the counseling, the treatment that they need. If school nurses aren't part of the equation, then you miss that early surveillance and identification that we are so skilled at.
Right, absolutely. And so switching over to Donna, and Donna, I know you've been at the helm there in the heart of Montgomery County. Talk a little bit about what the changes you've seen, certainly in the role, of course, that you've seen just from the association level in terms of COVID-19, and how you're going to have to address these tremendous changes.
Well, thank you, Christine, for having us on today. COVID-19 has changed everyone's world. I mean, we know that from our office in Silver Spring, where we went to a full virtual office the week of March 16th, and we're still in that. We also know that those mental health concerns that Laurie spoke of are impacting at least the stress of staying at home impacts families, not just the students alone. And those students reflect that. And so part of what we've been doing as an association, we got out in front right away at the end of February to make sure school nurses had an understanding of how this pandemic was affecting them. And we wanted to learn from them. And so we began developing resources on our website. Those resources have been updated. We point to other resources from the CDC and other federal agencies, other associations that we work with. And those that guidance is available and those resources at nasn.org. So we invite you and your viewers to see what's going on. The most recent guidance Laurie spoke about, and that's the re-entry guidelines for when schools open in a face-to-face setting. What we have learned is that we have had to adjust in many ways as an association whose mission is to make sure that students are healthy and well so that they can learn by advancing the practice of school nursing. And so we've had to step up our online learning, which we already had. We've had to make sure that school nurses' voices are heard, and we're hearing them. We also needed to continue with some of the advocacy that we had, making sure that we are educating legislators and other decision makers and policy makers to make sure that they know that we believe every student needs to be healthy, safe, and ready to learn. We know that from the school nurse perspective, we want to make sure that policymakers understand what students need. And so we've been very vocal about that. And we're actually looking at working with lawmakers to make sure that students have what they need when they get back to school, and that's a school nurse. Right. Laurie already mentioned that 25% of the schools in this nation don't have a school nurse at all. And about 35% of them have a school nurse part-time. We believe that school nurses are not only the first defense for students who have health conditions or health issues at schools. School nurses are the eyes and ears of public health. And so prevention is very much at the core of what school nurses are doing, as well as health promotion, as well as being those who make sure that they see as sentinels, as Laurie said, what's going on in that school community and intervening early.
That's right. Absolutely. And it is shocking to know that a lot of schools in this country don't have a school nurse, or some of the counties in this country have maybe one nurse that's shared among maybe 8 to 9 schools. So that's quite shocking considering the population that you really have to deal with in terms of the student population and the issues. And there's just so many issues that school nurses that you don't think about, but they certainly are confronted with every day. So it's really shocking. In terms of just the fact that a lot of these school nurses, what I've heard and they're also now acting as sort of first responders, and they're stepping up, taking on amazing heroic roles right now in the middle of COVID-19. So we're grateful to them as well. And please pass that on to your membership, because we know they're doing some really heroic things, and they're stepping in.
That's right. That's right, Christine. And Laurie has actually been talking to those school nurses in virtual ways. And Laurie, can you share a bit about what you've heard from the front lines?
Yes, I can. Christine, you're so right. We have members of our organization and other school nurses, maybe who aren't members, but they are working in emergency rooms in their community, sharing their expertise. They're working testing centers, making sure that the population has access to testing and that we can have more accurate data about the burden of COVID-19 in our communities. School nurses are training to conduct contact tracing, magnifying the capacity of their local health departments. Local health departments are swamped right now, and school nurses historically have collaborated with health departments, as I mentioned earlier, surveillance, but we have also assisted them historically in that contact tracing. So we know how to do that. We're receiving health department specific training and expanding that capability. I do want to say that school nurses are also working virtually within their school districts to continue to support their communities. They're producing health education videos. And I think this is a great idea for when schools are meeting virtually, but I also think it has a place in the future of school nursing, when it may be difficult for a school nurse to visit every classroom in the school building or every classroom in 8 or 9 school buildings, right. But they can deliver that video message for teachers to use when students need a bit of a break, and they can stand up and stretch and listen to the school nurse deliver a health education message. So our members are innovative, and they're learning how to expand their practice into this virtual world.
Yep, that's wonderful, wonderful. Well, we're going to take a short break. We'll be right back, and we'll talk more about what heroic things that these nurses are doing across the country. We'll be right back.
There's a balance between understanding that the coronavirus impacts you as well as older people and avoiding panic or anxiety about this illness. Follow guidelines, stay away from other people as much as possible, and keep up healthy habits. Follow a near-normal routine, especially while school is out. Also realize that if you feel anxious or depressed, you are not alone. There are resources online to help you.
This message brought to you by the Maryland Department of Health.
Welcome back. You're watching The Next Word. I'm your host, Chris Warnke, and today we have two special guests. We have Donna Mazyck, who is the Executive Director of the National Association of School Nurses, located right in the heart of Montgomery County in Silver Spring, as well as the President of the National Association of School Nurses, Laurie Combe. And they're here today to talk about what is happening in the next couple months in terms of getting parents ready when they send their children back to school and what to expect. So, Laurie, I'm going to turn to you. Talk a little bit about the guidelines the School Nurse Association has in place in terms of what they're going to be telling parents and the public school officials around the country.
Well, Christine, our reopening guidelines are pretty extensive and address many areas of concern. But I think the first thing that school nurses want to collaborate with their administrators on is communication to parents, to families, about the ways that the school is going to ensure that their children are safe in coming back to the classroom, what those procedures look like. In some instances, if there's a heavy burden of disease in the community, maybe parents will have to stay away from school buildings for a while. And so I think if you just deliver the messaging up front, then there are no surprises in the community. So each school system will customize that to their own setting. We're talking about personal protective equipment and which staff members need which type of personal protective equipment. Teachers and students might wear face coverings. School nurses, if they're managing students who have like nebulizer procedures where respiratory secretions are moved through the air, might need more personal protective equipment like the N95s that you've heard about in the news. So making sure all of those guidelines are in place. School nurses will be engaged in our care coordination activities to address the approximately 27% of our students with chronic illnesses, because we know that that population is at greater risk for disease. So working with their healthcare providers to translate that healthcare plan into the school setting, keeping those students safe, right? We'll be talking about how to work food distribution. Will it be better for students to eat in the classrooms as opposed to congregating in the cafeteria? We talked earlier about how to give students physical exercise, so staggering those recess times perhaps, right? We conduct lots of state-mandated screenings in the schools. And if, as anticipated, we're seeing more students in the clinic because of fear in the community, then there might be delays in those screening, and we need to communicate that. We need to coordinate that with state agencies that mandate those screenings for us. So school nurses will be involved in many, many activities to support returning campuses to, I'll say, the new normal. of operation.
Which is a huge, it's a huge, could be huge burdens and of course huge undertakings on behalf of the school nurses in this country. And I, at least the next 4 months are be tremendous. You're going to spend a lot of time, I guess, preparing, certainly for the opening in the fall.
Correct.
I know each district is, your funding and and the work you do comes through certain different departments within throughout the United States. So in the state of Maryland, and I'll turn to Donna about this. Donna, can you talk a little bit about Montgomery County as an example? And I know you all cooperate, obviously, with the Montgomery County government. Can you touch upon that in terms of how you all are working? And obviously, it's going to be a whole new way of working, and to anticipate issues that are going to be coming up. So, Donna, I'm going to sort of ask you to talk a little bit about your work with the Montgomery County Public Health Department as an example.
Yes. So the National Association of School Nurses has had the opportunity to partner with the Montgomery County Department of Health and Human Services School Health Services Program to provide education for their school nurses on a variety of topics, dealing with emergencies in schools, as well as diabetes management for students in schools. What is wonderful about Montgomery County in Maryland is that there's a long history of collaboration between the Montgomery County Public Schools and the Montgomery County Department of Health and Human Services School Health Services Program. So they work well together and they plan ahead. So they're already most likely in that planning stage, talking about what it would look like for Montgomery County schools to resume meeting face-to-face. And that partnership is very key in making sure that the students in this county are healthy and that they're safe. And their school nursing partnership with the public schools will make that happen for those students.
And I know in some cases you do deal with the public the education offices, correct?
Both Laurie and I actually have worked with these departments, the state departments of education or the state health department, where they may have what we call state school nurse consultants. And those are consultants who help make sure that the public school students have what they need in terms of health and safety. And in Maryland does have at the Department of Education a state school nurse consultant who actually provides consultation to all of the counties in the city of Baltimore. Laurie has seen that from state levels as well.
Getting down to more of a personal level, Donna, I looked at your bio. I mean, you have you have many degrees. What prompted you to get into the whole nursing kind of field? I love it. And I'm encouraging more and more people, including my daughter, to do this because I just think it's just such a wonderful field to get into. And for the viewers out there, it's a growing and expanding arena.
Well, you're talking. Yes, Chris, you're talking today to two avid advocates of going into nursing as a career. So I began in nursing. I went to a university and actually transferred into the nursing program, and I never looked back. One of the things that inspired me about nursing was my rotation in public health nursing. And when I learned how much I could do to work with populations to help them to be as healthy as they could, that was the ticket for me. And so my whole career has been on working with the public. And when I got to school nursing and worked with school students, oh my, that just set it off. How about you, Laurie?
I was first inspired to nursing during a time when my mother was hospitalized. And I recognized during that time, I was a young girl, That the nurses were at the bedside, they were comforting her, providing her with care, but they were also attending to me, right? So they had that holistic view of the family. And so I knew that I wanted to be a nurse. I've done a variety of things. I worked in mental health. I was a nurse educator. I worked hospice nursing. And then 27 years ago, I found this passion of school nursing where I could work with families over time, sometimes working with their first, second, third, even fourth child, right? And you build trust over time in that relationship, and you can really change the trajectory of student and family health within the context of these relationships. So it has been a very gratifying and rewarding profession to be a school nurse.
And I guess we're going to have to close soon, but if you had to give one message to President Trump right now, facing what we're going to be facing in the next 6 months, what would that message be in terms of the need and what you're going to need as an association, and to make sure that our children are protected? And
I want President Trump to recognize that 2020 is the International Year of the Nurse and Midwife.
We've been making a film for International Nurses Day to recognize the incredible work of nurses and midwives.
We all have things to be thankful for.
I'm thankful to the nurses who took care of my wife when she was seriously ill in hospital last year.
I'm thankful that nurses and midwives are helping us make progress towards health for all throughout the world.
I'm thankful for the midwives we had when our children were born.
2020 is the International Year of the Nurse and the Midwife.
Currently, the world faces a shortfall of 9 million nurses and midwives.
Millions of people around the world rely on nurses.
There was so much more that could have been said. I was going to talk about how nurses saved my life, twice. But then the COVID-19 pandemic happened and made it impossible for us to continue filming. Now, the message is clearer than ever. We need nurses and midwives now and in the future to ensure access to health for everyone, everywhere. International Nurses Day is the perfect opportunity to say a huge thank you to all the nurses and midwives around the world who work tirelessly, often without thanks, to keep us all safe. It is vital that governments equip nurses and midwives with leadership skills so they can lead and inspire the next generation to save lives. Share your own story and let's say a huge thank you to nurses and midwives around the world.
And it's in celebration of my nursing hero's 200th birthday, Florence Nightingale, who proved that nursing care makes a difference in health outcomes, and that school nursing care makes a difference in the health outcomes of students, staff, families in the larger school community, and that I plead with him to fund 10,000 school nurses for this upcoming year to address the many concerns that we've discussed today that school communities will meet in the next school year.
Oh, that's great, Laurie, and thank you. And I say on that note, and I'm grateful to both of you. Please tell your membership. We're all grateful to your entire membership for being out there on the front line as we move forward. And thank you for being on the show today. It's been a real education, and thank you. So
Thank
night.
you. Thank you, Christine. And we'd ask your viewers to thank a nurse and
Yes.
thank school nurse today.
Absolutely. Absolutely. So you're watching The Next Word. Thank you very much. And tune in for this taping, which will be next week. Thank you. Good night.